A coronavirus variant that could be resistant to vaccines. The WHO is monitoring a mutation from Colombia known as MU. Let's take a closer look at that story. Professor Tiki Pang joins us from the National University of Singapore. Professor Pang, this MU variant is still seen in small numbers, but as in the case of Delta, could this situation change rapidly?
Yes, of course, Jill, it can change quite rapidly. But as you said, at the moment, it's still fairly limited. Colombia has a lot of dominant, 39%. Europe still very low. I think perhaps the only redeeming factor is that with Colombia, at least, I think the travel links to Asian countries is perhaps not so extensive. So it could mean that could be a bit of a delay in that new variant spreading to other parts of the world. But for me, it's really just a matter of time, as we have seen with the Delta. In terms of how fast, we'll have to wait and see.
And what does this mean then for vaccines?
Yeah, I think you mentioned, I think the news mentioned that it could be resistant to vaccines. But I think really it's much too early to say. Probably need a lot more research. But perhaps the bigger concern is not so much resistance to vaccines, but is it going to be able to spread more rapidly, just like what happened to Delta, and also whether it's going to cause more severe disease. So it's vaccine resistance, rate of spread, as well as severity of disease.
And how do you think these factors that you mentioned then factor into countries who are trying to plan to live with the virus endemically?
Yeah, I don't think it has a major impact on countries' plans to deal with this virus in terms of endemicity. What I've seen so far with all the other variants and the existing vaccines, yes, they may be a bit less effective, but I've not seen anything to indicate that this new variant is going to be totally resistant to existing vaccines. So I think the plans will continue vaccination coverage, and importantly, to have the capacity to monitor the variants as and when they appear. This means the capacity to sequence isolates in each individual country to get a very early warning in terms of whether these mutants will start appearing.
So what precautions should we be taking then as new virus mutations continue to emerge?
Yeah, I think, Steve, this is a fairly standard question. I think we definitely must continue with existing and proven public health interventions, in addition to vaccination, of course. So I'm talking about, continue to wear masks, continue safe distancing, continue to avoid crowded gatherings wherever possible. So I think those standard precautions remain in place.
All right, many thanks for speaking to us this evening. Professor Tiki Pang from the National University of Singapore.